Hello guys, so now we shall be discussing regarding the perineum. Okay, so our topic of discussion would be regarding the perineum. So whenever you are discussing regarding the perineum, first of all you have to know what are the borders of the perineum, right? So from these pictures you can see that basically we have got two different types of borders. One is called as the anatomical borders and the other one is called as the surface borders. Okay. So in this first picture, what is this first picture? This is a picture from below, right? From beneath. You see, this is a picture here. So this is the same picture over here. Okay. So in this picture, what I'll be telling you is, I'll be telling you the anatomical borders. Okay. And in this particular picture over here, I'll be telling you the surface borders, which means this picture over here, I will be telling you the surface borders. Okay. So what are the two borders? We have got anatomical borders and we have got the surface borders. But before we draw the anatomical and surface borders, first of all you need to know that the perineum is having two important triangles. Okay, perineum is divided into two important triangles. What are those two important triangles? One is called as the urogenital triangle. One is called as a urogenital triangle. And the other one is called as the anal triangle. Okay, so there are two important triangles. One is called as your urogenital triangle, right, which is responsible for the urination, and the anal triangle is responsible for the defecation. So there are two important triangles. One is called as your urogenital, another one is called as your anal triangle. Okay, now where is this urogenital and anal triangle? You can see here the upper the red color triangle which you can see, that is called as the urogenital triangle, and the lower green color triangle which you can see is called as the anal triangle. Okay, so what are the borders of this urogenital and anal triangle? I will discuss later on, but right now I just want you to know what is urogenital triangle and what is anal triangle. But for now what we will discuss is that we will discuss what are the borders of your perineum. Okay, so if you look at this particular picture over here, now in this particular picture, what are the structures you can see? The first important structure is that you know that this particular bone which I am highlighting here, right, this particular bone over here is called as your pubic symphysis, right? So this particular bone over here is called as your pubic symphysis, right? Second important thing is that you see this particular bone which is present on the sides, right? So this particular bone which is present on the side, this is called as ischiopubic rami. What is this? This is called as ischiopubic rami. So this particular structure is your ischiopubic rami. Okay, so this is your ischiopubic rami. And finally, down here, what is this particular bone you see here? This is called as the tip of your coccyx. This is the tip of your coccyx, right? So here also the same structures. You see, this particular part is the tip of your coccyx, and these two structures are called as your ischiopubic rami, and this is called as the pubic symphysis, right? So in between these structures, you see a triangle here. You see not only a triangle, you see this complete area. This area is called as your, what is this, perineum. So if I join all these areas, for example, if I join pubic symphysis all the way down here, okay, and from here if I join this area all the way down till the tip of the coccyx, and from here all the way till the ischiopubic rami, and from here till the tip of the coccyx. Now this entire area which you can see within the box, this is called as your what? This is called as your perineum, right? Now what did I tell you? Perineum is consisting of two different borders. One is called as the anatomical borders and the other one is called as your surface borders, right? So first, whatever borders I have just written right now are called as your anatomical borders. The borders which I have just written, right, these borders are called as anatomical borders. For example, let us say, what is the anterior border? Anterior border I have already written. Anterior border is what? Pubic symphysis. Pubic symphysis is the anterior border. Okay. Now next important thing is that, for example, what is the lateral border? Now you will tell me what is the lateral border. Lateral border is what? Lateral border is having ischiopubic rami. Lateral border is having ischiopubic rami. Ischiopubic rami. Okay, so this comprises of the lateral border. Next, after the lateral border is then the last border is the inferior border. Inferior border. So what is inferior border consisting of? Inferior border is consisting of the tip of the coccyx. Inferior border is consisting of your tip of your coccyx. So these are the three important borders. One is your pubic symphysis, another one is your ischiopubic rami, and next one is your tip of the coccyx. Okay, so these are the three important what borders? These are the three important anatomical borders, okay, that you have over here. Right. Next important thing, so these borders which you see are called as anatomical borders. Now after this anatomical borders, the next borders which we shall be discussing right now are the surface borders. Okay. Now let us not discuss the surface borders in this particular picture over here because this is not that clear, right? So let us discuss the surface borders in this particular picture over here. Now even in the surface borders also, first of all let me put the points and then let us join the points. Okay. So all of you know that here you have got what? Pubic hair. So this pubic hair, the region where the pubic hair is present, this area is called as mons pubis, right? So what I'm doing is that I'm putting a point over the mons pubis, right? And next important thing is that these are your thighs. So here you come across your thighs like this. And this is the anus, all of you know. These are the thighs and this is the anal pore, right? Now next important thing is that what I'm telling you, I'm putting 2 points over here. These 2 points are the medial angle of the thighs or medial surface of the thigh, yes or no? If I'm drawing a line like this point is called as a lateral surface of the thigh, whereas this point which I've drawn before, this one is called as a medial surface of the thigh. And finally, you even have got a cleft over here. This particular cleft is called as infragluteal cleft, right? You know, you have got 2 gluteus muscles, right? So let me show it to you right over here. See here, this is one gluteus, this is another gluteus. So in between both the gluteus, you have got a cleft. This cleft is called as, what is this? Intergluteal cleft, because it is present in between the gluteal regions. So if I start joining all these lines over here also, this area whatever you can see over here is called as what? This is called as your perineum, right? So in this particular perineum also, you can see 1, 2, 3 important borders. So these 3 important borders are called as surface borders. So let us list out what are these surface borders. What are these surface borders? Okay, so first, this border over here is called as your anterior border, right? And these borders are called as your lateral border. And finally, you have got an inferior border, same like anatomical. This is called as your inferior border. So this one over here is called as your anterior border. This one over here is called as your lateral border. And this one over here is called as your inferior border. Okay, anterior border, lateral border and inferior border over here. Now anterior border is having what? Anterior border is having your mons pubis. Anterior border is having mons pubis. Lateral border is having what? Medial surface of the thigh. Medial surface of the thigh. Inferior border is having what? Intergluteal region. Intergluteal cleft. Intergluteal cleft. Okay, so this comprises of the inferior border. So how many borders we have discussed so far? One is we have discussed the anatomical borders. After the anatomical borders, the next important thing we discussed is the surface borders. Coming to the anatomical borders, anteriorly we have got our pubic symphysis, laterally we have got our ischiopubic rami, and inferiorly we have got the tip of the coccyx. Okay. Next, down here, surface borders, anteriorly we have got the mons pubis, laterally we have got the medial surface of the thigh, and inferiorly we have got the intergluteal cleft. Okay, so these are the surface borders which we have discussed, right? Now, next important thing is that, what did I tell you? I told you that we have got two important triangles in the perineum, right? So what are the two important triangles in the perineum? Perineum is comprising of two important triangles. What are those two important triangles? One is called as the anterior urogenital triangle. Anterior urogenital triangle. Second one is called as a posterior anal triangle. Posterior anal triangle. Two important triangles, anterior urogenital triangle and posterior anal triangle, right? Now, when it comes to the posterior anal triangle, so you can see this picture. This is the posterior anal triangle. Now, why are you calling it as posterior anal triangle? Because this aperture which you can see is called as anal aperture. Anal aperture. Okay. Now, after this anal aperture, now what is the important thing you should know right now over here? Right now over here is that, don't confuse what is this new picture over here, right? So this is the same picture here. You see, actually this posterior anal triangle, whatever is there, this will be same for both the males as well as females also. Yes or no? So this is a male patient, right, where we are discussing about the posterior anal triangle, and this is his penis. Okay. Now look at the posterior anal triangle over here. So let me show it to you here. Posterior anal triangle, in the sense, see this green color triangle which you can see is called as your posterior anal triangle. Okay. So in this posterior anal triangle, what are the contents? The first content I have already told you, that you have got what? You have got this particular structure called as anal aperture. This is the first important structure. Second important structure, what do you have? What do you have? This particular arrow is pointing towards external anal sphincter. External anal sphincter. This is your external anal sphincter. Third important thing, whatever you have over here, is called as ischioanal fossa. How many ischioanal fossas are there? This green color thing which I have highlighted over here is called as your ischioanal fossa. There are two ischioanal fossas, one on the right and one on the left. Okay, so this is your ischioanal fossa. So how many are there? There are two ischioanal fossas are there. So overall, if I have to write down what are the contents, right? What are the contents? Contents of what? What are the contents of posterior anal triangle? What are the contents of posterior anal triangle? So tell me, what will be the contents of the posterior anal triangle? The first important content is that there is anal aperture. Anal aperture is one important content. Second important content is external anal sphincter. External anal sphincter is the second important thing. Third important thing is ischioanal fossa. Ischioanal fossa is the third important thing. And fourth most important thing is that you even have pudendal nerve. You even have pudendal nerve that is running in between over here, right? So these are four important things which you can see over here, right? So in this picture very clearly you can see over here that where is urogenital triangle and where is anal triangle. So if I join all these points over here, you will very clearly understand that, see here, this triangle which I am drawing right now, right? So this particular triangle is called as your urogenital triangle. Now beneath the urogenital triangle, another triangle I am drawing right now, this triangle which I am drawing right now is called as your anal triangle. Okay, so the top one being the urogenital, this is called as the urogenital triangle. Okay, and this one over here is called as your anal triangle. Urogenital as well as your anal triangle. Okay, now within the urogenital triangle, what do you have? I told you, within the urogenital triangle you will have urethral orifice. Within the anal triangle, what do you have? You will have anal orifice. So the upper urethral orifice and this one lower is your anal orifice. Okay, so these are some of the very important things which you need to know. Okay, right. So regarding this urogenital triangle, if you look at the borders of this urogenital triangle, what are the different borders? Previously we discussed borders of this entire perineum, right? Now I am discussing the borders mainly of your urogenital triangle. So regarding this urogenital triangle, there are three important borders. What are those three important borders? The first important border is pubic symphysis. You see this point? So this is called as your pubic symphysis. Pubic symphysis is the first important border. Next important border is ischiopubic rami. Again, see this particular rami which you can see over here is called as ischiopubic rami. Ischiopubic rami is the second important one. And third important is, this is just an imaginary line that is drawn between two ischial tuberosities. See here, this tuberosity which you can see, one ischial tuberosity, you see another ischial tuberosity. So if I am drawing an imaginary line between two ischial tuberosity, that becomes the third one. So this is an imaginary line between two ischial tuberosities. Imaginary line that is drawn in between two ischial tuberosities. So there are three important things. One is called as your pubic symphysis, another one is your ischiopubic rami, and third is your imaginary line that is drawn between your two ischial tuberosities. Okay, right. Now the next important thing I want to discuss over here is that within this urogenital triangle, the upper triangle is called as your urogenital triangle, right? So see, this upper triangle is called as your urogenital triangle. Now within this urogenital triangle, if I ask you what are the layers that are located from deep to superficial, what are the things that are going to tell, guys? So if this is a urogenital triangle, right? If you wanted to look at the layers from deep to superficial, deep one layer in one picture, above that another layer in another picture, right? The third layer you should see in a third picture. But in a single picture, if I wanted to see all these structures, what I'm trying to explain you is that, for example, let us say this is a remote, right? Now let us say this remote is made up of 10 layers. If you wanted to see 10 layers, then what you have to do, I have to remove one layer and put it here, right? Next, remove the second layer, put it here, remove the third layer, put it here. So 10 pictures, 10 layers. No, I wanted to see it in a single picture. Then can you look from the top, from the bottom? No. What will you do? You will cut it like this. When you do a coronal section and cut it, you can see all the 10 layers down, right? So this is that particular section. Now in this particular section, what are the different layers which you can see over here, right? Now just look at this particular picture over here. Now in this particular picture, what are the important things which you can see? You see this pink color layer. This pink color layer is nothing but called as your deep perineal pouch. Okay, what is this pink color layer? That is called as your deep perineal pouch. So this pink color layer which you can see, right, this pink one over here is called as your deep perineal pouch. Now after deep perineal pouch, the second layer you have is the perineal membrane, this red one. This red color line which you can see. Okay, let me rub this out and write it, draw it a little bit farther. Right, after that you see this red color one, this particular red color line which you can see, this one over here is called as your perineal membrane. This one over here is called as your perineal membrane. After this perineal membrane, you see this yellow color one. This is called as superficial perineal pouch. This yellow color thing which you can see is called as, this yellow structure you can see is called as your superficial perineal pouch. Superficial perineal pouch. After superficial perineal pouch, you have got deep perineal fascia. This green color fascia which you can see right now, this green one is called as deep perineal fascia. Deep perineal fascia. After this deep perineal fascia, the next layer which you have got is superficial perineal fascia. So this particular fascia which you can see is called as your superficial perineal fascia. This is called as your superficial perineal fascia. So these are some of the layers that are located from outside to inside, right? So these are the layers which follow an order in this way, right? So these are the layers that are located from the deep to the superficial. So in the deep you have got the deep perineal pouch, next you have got is a perineal membrane. After that you have got is the superficial perineal pouch, next you have got is a deep perineal fascia and superficial perineal fascia. Now within the superficial perineal fascia also you can see only one blue line over here, right? Only one blue line. Actually within this superficial perineal fascia there are two more fascias. What are those two more fascias? One is called as superficial layer, another one is called as deep layer. So one is called as superficial layer, another one is called as deep layer. And you know the name of the deep layer is also called as Colles fascia. It is also called as Colles fascia, right? So deep layer is also called as which fascia? That is also called as your Colles fascia, right? Right. The next important thing which you need to know is perineal body. So what is perineal body over here? So just look at the picture over here. So let me show you where is this particular perineal body. So the topic which we shall be discussing is perineal body. Now regarding this perineal body, where is this perineal body? Now you are aware of this picture. You know this picture because already we have discussed enough about a triangle over here, right? We have discussed about a triangle like this. Yes or no? Actually this is not the triangle. This is how we discussed a triangle like this. Clear? And we discussed it into two halves. Now where is the perineal body over here is that this yellow part which you can see in the center, right? So this yellow part in the center, whatever you can see, is called as your perineal body. This is called as your perineal body. Okay, so this is your perineal body. Now important thing to know is that there are some muscles, you see there are some blue color muscles on either side, some green color muscles. So there are some muscles that are attached to this perineal body. Now in this particular picture, let us see what are the different kinds of muscles that are attached. Later on I will show you individual muscle. Okay, so if you look at the muscles, the first important muscle, where is the first important muscle? So the first muscle is called as your puborectalis muscle. Puborectalis muscle. See, before I show you puborectalis, you should know that this particular muscle which I am drawing right now surrounding the anus, this is called as external anal sphincter. Out to the external anal sphincter, you have got another group of muscle. For example, this one. You see this muscle, right? So this muscle number 1 is nothing but called as your puborectalis muscle. Now after this puborectalis muscle, coming to the muscle number 2, that is called as pubococcygeus muscle. Pubococcygeus muscle. Now where is this pubococcygeus muscle? The muscle outside the puborectalis is called pubococcygeus. See here, this particular muscle. Okay, so this particular muscle, that is muscle number 2, is called as your pubococcygeus muscle. After pubococcygeus muscle, the third important muscle is called as iliococcygeus muscle. Iliococcygeus muscle. Where is this iliococcygeus muscle? See this particular muscle over here on either sides, this is called as your iliococcygeus muscle. Clear? So the third one is also called as your iliococcygeus muscle. So the pubococcygeus, the puborectalis and the iliococcygeus, 3 of them together you call as levator ani muscles, right? So 3 of them together you call them as levator ani. They are called as levator ani. So what are they called? They are called as levator ani. Now all of them are attached to this center point, see. this center point over here is nothing but called as your perineal body. Okay. Now all these muscles are attached to the center point. Now from the top also there are some muscles that are coming down and attaching to the center point. What are these two muscles? See, this particular muscle which you can see right now on both the sides like this, right? So this particular muscle over here is called as deep transverse perineal muscle, right? I'm writing it as muscle number 4. Muscle number 4 is a deep transverse perineal muscle. Deep transverse perineal muscle. This is called as deep transverse perineal muscle. Now after that, you see this particular muscle over here, right? So this particular muscle which I'm drawing right now, this, let us say this is muscle number 5, muscle number 5. After, if it is deep here, the next one will be superficial. Superficial transverse perineal muscle. Transverse perineal muscle. Okay, one is called as a deep transverse perineal muscle and the other one is called as your superficial transverse perineal muscle. So these are the 5 important muscles which you can see over here, right? Now next important thing is that surrounding your urogenital area, urogenital aperture. See, this one over here is your urogenital aperture. Surrounding this, there are 2 muscles which are in the form of a bulb-like muscles or spongy muscles, right? See, there are 2 bulb-like or spongy muscles. I'm writing it as muscle number 6 here. You see this muscle, which is bulging, right? Which is like a bulb or which is spongy. So this bulb-like or spongy muscle which you can see, that is muscle number 6, is called as bulbospongiosus muscle. Bulbospongiosus muscle. Bulbospongiosus muscle. Okay. So can I tell that all of these muscles are in relation with the perineal body? Right. So what are the muscles that are in relation with the perineal body? The first important muscle being, what is that? That is called as your, one is called as your puborectalis, pubococcygeus and iliococcygeus. Puborectalis, pubococcygeus and iliococcygeus together you call them as levator ani. Next you have got is a deep transverse perineal muscle. Next you have got is a superficial transverse perineal muscle. And finally you have got your bulbospongiosus muscle. Let us look at these muscles right now. Okay. So if you can look, this is your pelvic bone. You are looking from inner side of the pelvic bone. Now I am telling you to look from the outer side of the pelvic bone. Now I hope this makes you perfectly clear, right? So here, this was a thing we were discussing, right? So there is one aperture on the top, there is one aperture on the bottom. So what was the first muscle which we discussed over here? We discussed puborectalis. Where is this puborectalis? See, this muscle is your puborectalis. This is left puborectalis. This is your right puborectalis. Why are you calling it as puborectalis? If you look from inside, you will understand. Look at this muscle from inside. All the way it is attached to the pubic bone, isn't it? From where will you see? Yeah, from here can you see? You see that muscle, it is attached to the pubic bone, right? All the way back to the rectum. That is why you call it as puborectalis muscle. Clear all of you? After puborectalis, what is the next? Pubococcygeus. Just side to that, this is pubococcygeus. Why? Because it is also attached to the pubic. You see here from the top, attached to the pubic or no? And back it is attached to the coccyx, right? So can I tell that is the reason why it is called as pubococcygeus, right? Third important one is iliococcygeus. Where is iliococcygeus? See, the muscle that is side to that is iliococcygeus. See, this one is iliococcygeus, right? So why it is called iliococcygeus? Let us see. It should attach from ilium to the coccygeus. See, one side it is attached to the ilium. Yes or no? Another one it is attached on the back to the coccyx. See here, back side it is attached to the coccyx. Yes or no? That is why you call it as iliococcygeus muscle. And next we discussed about superior transverse perineal muscle and deep transverse perineal. Where is this superior and deep? Let us look here now. Where is the superior and deep? Yeah, this one. See, this muscle is deep, this muscle is also deep. So these two are your deep muscles. Okay, next we have discussed about superficial transverse perineal. See, these two fan like muscles are called as superficial transverse perineal muscles. Okay, and after that bulbosponges I told you, right? So where is this bulbosponges? See, this is your bulbosponges, left as well as the right bulbospongosus muscle. So I hope you understood, right? I hope you understood what are these three important muscles over here, right? So now what we shall do is that we shall actually discuss what is the important nerve supply. We shall actually discuss about the nerve supply. Now coming to the nerve supply, first important thing you need to know that the nerve over here is your pudendal nerve. What is this now? Pudendal nerve. Okay, so what is the nerve root? S2 to S4. That is a pudendal nerve root. Now next, what is the artery over here? What is the artery over here? That is your inferior pudendal artery. Inferior pudendal artery. Right? So what are the things we just discussed over here, guys? We discussed few important things. For example, we discussed all the way from here. We discussed in the perineum we have got two important there is two important triangles basically. One is called as the upper one is called as a urogenital triangle and the lower one is called as your anal triangle, right? Now when it comes to the urogenital triangle, what are the anatomical borders and all we discuss. But overall for this entire triangle like this, what are the borders we discussed? There are two important borders. One is called as your anatomical borders and the other one is called as your surface borders. Coming to the anatomical borders, anterior border is pubic symphysis, lateral border is 𝐒𝐲𝐵𝐞 and inferior border is tip of the coccyx. When it comes to the surface borders, anteriorly we have got mons pubis, laterally we have got the medial surface of the thigh and inferiorly we have got the intergluteal cleft. Okay, and coming to the posterior anal triangle, these are the contents of the posterior anal triangle. Everything is visible in the picture. Okay, so these are the borders of the urogenital triangle over here. Now next important thing is that what are the layers that are all the way from deep to superficial. From the deep till the superficial, these are the layers. So this is something which important thing which you need to know regarding the perineum region, guys. So thank you so much for watching my video. Goodbye.